Hi, my name is Abigail Eli, and I will be speaking about EMDR, eye movement desensitizing and reprocessing therapy. We're going to be specifically talking about the calm, safe place technique. EMDR was developed by Francine Shapiro in 1987 and is an evidence-based treatment for trauma and PTSD. EMDR therapy is based on the AIP model, which believes that traumatic memories haven't processed properly in the brain and have somehow become stuck in the amygdala, uh, or the hippocampus. And the hippocampus, maybe it's because it didn't properly encode the context of what was happening, or the amygdala, it's where intense emotions are felt. So sometimes traumatic memories can get stuck in those places. EMDR will use bilateral stimulation, similar to REM sleep, where your eyes move back and forth. Or they will have you follow maybe their finger and have your eyes move back and forth. So bilateral stimulation, typically they use eye movements, but it also could be tapping left, right, or sounds to help the brain to bring the traumatic memories back to the working memory, which is a function of short-term memory. It then reprocesses those memories in a way that reduces their emotional charge. So it will help to facilitate and complete the processing of that memory that where it had gotten stuck. It's going to help complete the processing that should have happened from the get-go. Anyway, the therapy follows an 8-phase protocol, which includes history taking, preparation, assessment, desensitization, installation, body scan, closure, and re-evaluation. The calm, safe place technique that we are talking about today is introduced in the preparation phase. So the purpose of the safe, calm place in EMDR is it helps with emotional regulation. Clients dealing with trauma may experience intense emotional responses when recalling distressing memories. Establishing this safe and calm place, it helps clients learn how to self-soothe and regulate their emotions, which is crucial for making the EMDR process manageable. The calm, safe place technique, also called the safe place exercise, is a strategy that helps clients find an internal sense of safety and calm that they can access whenever they're feeling distressed or overwhelmed. And this is how it works. The therapist is going to guide the client to imagine a place, whether it's real or imagined. It's going to be a place where they feel completely safe, peaceful, or calm. It could be maybe in their mother's arms, or the beach, a garden, maybe in a room hanging out with their family, or it could be just completely an imaginary location. The main thing is that it's a place that the client feels completely safe. Once the client identifies that safe place, the therapist is going to enhance that experience by engaging all of their senses, by asking questions like, hey, what do you see? What kind of sounds do you hear? What do you smell around you? What physical sensations do you notice? The multi-sensory engagement, it helps to make the image more vivid and accessible. This is where EMDR's unique approach comes in. The therapist pairs this calm, safe place imagery with the bilateral stimulation, usually slow eye movements or gentle tapping. This pairing helps to encode a sense of safety more deeply in the nervous system, which is making it easier for the client to access this calm state again when they need it. The client is also taught keywords or phrases such as beach or I am safe. And that'll help them to be able to bring that feeling of calm back quickly, even if they're outside of the session. So the EMDR is effective because it retrains the nervous system to access the state of safety, which is, of course, empowering for the client. The calm, safe place technique is a bottom-up somatic approach to trauma treatment. Rather than working through cognitive understanding or talking about the trauma, EMDR focuses on the parts of the brain that manage instinctive responses, emotions, and memories, which are at the bottom and bypasses the intellect or need for conversation. This technique works directly with the body and nervous system. By pairing the pleasant, safe place imagery with bilateral stimulation and bodily sensations, EMDR is helping the autonomic nervous system to establish a sense of safety again. This somatic focus helps clients regulate their nervous system responses without needing to intellectually process their trauma first, which is especially helpful for clients who are emotionally dysregulated. EMDR is definitely it's evidence-based and strongly supported by research. The American Psychiatric Association, the U.S. Department of Veterans Affairs, the Department of Defense, the United Kingdom's National Institute for Healthcare and Excellence, and the World Health Organizations and multiple global organizations now recognize the effectiveness of EMDR therapy. EMDR is recommended in clinical practice guidelines as a first-line treatment for PTSD. And it's due to its proven effectiveness in treating psychological trauma, EMDR is now also recommended by the World Health Organization. In one particular study with 308 participants diagnosed with PTSD, 66% met the ICD-11 diagnostic criteria for complex post-traumatic stress disorder, CPTSD. Impressively, after 8 days of treatment, 88% of those individuals that were classified as having CPTSD no longer met the diagnostic criteria. So out of that 66% that met that criteria, 88% of those no longer met that criteria. First, so some of the benefits of this technique is it gives the clients immediate tools for self-regulation before they begin processing the harder traumatic memories, which can help them to not feel overwhelmed or re-traumatized. Second, it's accessible to most clients of various backgrounds, no matter the age, gender, as long as they are able to engage with imagery. Third, it empowers clients by giving them a portable resource that they can use anytime and anywhere. Veterans, especially, tend to gravitate to this method because it does not require them to verbalize or talk about their traumatic memories. Instead, it allows the client to hold the traumatic event in their mind and focus on it during the treatment process. And they will later pair that memory with the calm, safe memory to help regulate the autonomic nervous system. There's so much evidence in demonstrating the efficacy of EMDR therapy in treating clients with PTSD. I mean, there's much evidence for showing how effective it is for clients that have PTSD, panic, depression, somatic disorders, addressing trauma, eating disorders, mood disorders, psychosis, chronic pain, and various other psychological conditions. Regarding the efficacy of treating chronic pain using EMDR, there were several randomized controlled trials in the treatment of chronic pain and conditions such as musculoskeletal pain, back pain, headaches, phantom limb pain, fibromyalgia, and rheumatoid arthritis, all of those things. These studies have all demonstrated the effectiveness of EMDR in reducing pain intensity, pain-related disability, and associated psychological distress. The limitations is some clients struggle with visualization or find it difficult to identify a safe place. Cultural considerations are also important. The concept of a safe place may not resonate equally across all cultures, and therapists need to be flexible in how they present this exercise. And furthermore, access to EMDR can be limited due to fewer trained therapists compared to other trauma therapies such as CBT, which can create barriers for clients seeking this kind of treatment. Some of the other dangers might be in history taking. They might have insufficient safety measures in the preparation stage. They might have intense emotions of dissociation. In the assessment stage, they might see physical effects starting to arise. In the desensitization, they may not find full closure. In the installation stage, they might have incomplete processing. And in the body scan, they may have incomplete processing. And so there are some potential risks at each of the phases. In Hawaii, EMDR is available through various providers, but there is limited availability on neighboring islands unless using a virtual platform. EMDR is offered to diverse populations, so adults, children, adolescents with PTSD, anxiety, chronic pain, various disorders, and trauma histories. For military families and veterans, Native Hawaiians, and Pacific Islander communities, though culturally adapted approaches are still developing. Here are some of the companies that are or resources that we can find EMDR therapists or treatment centers. The Present Mind Institute of Hawaii, and some of them are on this island, and others are on other islands. But Psychology Today will give you an access to therapists that are available statewide, and Present Mind Institute of Hawaii as well. So to get your EMDR license, you have to have your license to be able to practice these techniques. You would have to hold a mental health license or be a graduate student who completed your core coursework. So you couldn't be in your first year. You have to complete the EMDRIA approved basic training, which is typically 40 to 50 hours, and it includes both the didactic instruction and supervised practice. And many practitioners pursue EMDRIA certification, which requires 20 hours of consultation and documentation of clinical cases. The training specifically covers resource development techniques like the calm, safe place before teaching the trauma reprocessing, because they recognize that establishing safety and is really foundational to effective EMDR treatment. So those who are just holding like a chemical dependency or substance abuse license, they will not qualify to be able to take this training because these typically lack mental health scope of practice, and graduate students might have to turn in some documentation to be able to take this training. So here are my references, and that's all. Hope you enjoyed it. Bye-bye.